One of the big differences, of course, between the US and Canada is that even in the worst case scenario where people are losing their jobs, they're not losing their health insurance. At this time, being a healthcare provider anywhere in the world is a weird mix of frightening and exhausting, and also, in a way, strangely exhilarating because everyone is focused. We're all pulling in the same direction. I think the Canadian government has done a lot to support healthcare providers in this struggle. We've seen huge amounts of money being put into income stabilization for people by the federal government, people who are losing their jobs as a result of the pandemic, which is hugely important, of course, for people's health and their ability to, stay in safe housing and feed their kids and know where their next meal is coming from. All of that's really important to health. There's always more that we could do, and we always wish that we had done it sooner, and we always wish that we had done more. We were late to the game in understanding how this was going to affect long-term care, nursing homes, shelters, and other groups of vulnerable people who are living in very close quarters. And so the whole healthcare system is having to pivot to consider a whole set of other places where we need to be, where healthcare doesn't traditionally necessarily focus. One of the big differences, of course, between the US and Canada is that even in the worst case scenario where people are losing their jobs, they're not losing their health insurance because every Canadian has access to universal public health insurance. At the same time that, of course, people are worried about losing their jobs and their incomes, they're not also worried about losing their access to healthcare in the middle of a global pandemic. One of the biggest pros about our health system that becomes obvious in a pandemic is that no one is delaying seeking care because of worries about the cost. Any Canadian who's worried that they might have symptoms of COVID-19 can come to an assessment center. Anyone who needs to be admitted to the hospital is admitted to hospital. Anyone who, God forbid, has to go to the intensive care unit or be put on a ventilator. Nobody is worrying in the midst of all this about how they're going to pay the bill, and therefore people are more likely to seek the care that they need, and I hope that they seek it sooner as a result of that. Of course, there are Canadians who want to see the economy opened up sooner rather than later, and there's a wide range of opinions. I would say the number of Canadians who are agitating and protesting to ask for the economy to be opened up is very small. Nobody likes physical distancing. Nobody likes feeling socially isolated, but I think most people understand that that's what it's going to take. To me, the biggest lesson in a crisis like this is the realization that we really are all in this together, and that healthcare system that leaves behind big segments of the population, sooner or later, that's going to catch up.